Next technique is going to be a subtalar joint assessment of mobility, or an intervention to actually restore mobility and mobilize the subtalar joint. So from an anatomy and biomechanical standpoint, what we have to remember at the subtalar joint is there's 3 anatomical joints, but functionally there's 2 joints. We have an anterior joint between the talus and calcaneus with a relatively concave calcaneus on a convex talus, and we have a posterior joint with a relatively convex calcaneus moving on a concave talus. So what I like to do when I'm assessing the passive motion glide at this joint is to kind of assess both joints with one technique. I like to wrap my one hand around the calcaneus. The key is that I'm not on the bottom of it, but I'm around the sides of the calcaneus. In this case, my thenar eminence and the heel of my hand is going to be on the anterior joint, as you can see laterally, and my fingers are going to wrap around to the back of the calcaneus on the side, so the posterior medial part, where I'm on the relative posterior joint. So on this case, what I'm going to do is I'm going to bend this leg out of the way for a second, key. On the model skeleton here, I'm going to passively invert the subtalar joint. On my real patient here, I'll block her talus, but I'm going to invert to the barrier, and now to give overpressure for the glide, the anterior joint, which is concave, moving on convex, I need to go in the same direction as inversion. So I'm going to take the anterior joint and pull it towards my thigh, and the posterior joint needs to go opposite. So as the calcaneus inverts, the posterior joint needs to glide towards the camera away from me. So what that looks like is this. I'm going to invert, and then I actually do a little bit of almost radial deviation extension, which is going to push the anterior joint medially and pull the posterior joint laterally. When I look to do eversion, the opposite motion, I'm just going to stand on the opposite way. I don't want to block the view here. On this left foot, I'll evert, then I'll take the posterior joint and go medial, and I'll take the anterior joint and go lateral. So I'll show you that on a real foot here on the left lower extremity. Hold that again. Slide this one straight. So looking at her left foot, if I want to work on subtalar joint eversion, again, I'm going to kind of say hello to the calcaneus, wrap around the sides of it. The thenar eminence of my hand is on the anterior joint. My fingertips are going to be on relative to the posterior part of her calcaneus. I like to use my forearm to keep her up in more of a neutral dorsiflexion position. I'm going to evert to the barrier, kind of by swinging my whole trunk back on that side. My right hand's going to block the talus as best I can, kind of wrap around the front of the talus under the malleoli here. I'm going to evert, and then from there, if I just do this little bit of radial deviation or wrist extension, the anterior joint is going lateral towards my thigh, and the posterior joint is going medial towards the camera. So this is what that looks like here. I'm going to evert to the barrier. I have a talus blocked with my right hand, and then I can mobilize from there or assess the passive glide at that joint in that position.